So I'd like to introduce the topic and the speakers. As I mentioned earlier on, we are going to be presenting information that I think is extremely useful to those of us who are on agricultural development in Africa, but specifically on food and nutrition issues, tracking performance in food safety, the African Food Safety Index that's been developed with the help of the African Union, specifically PACA. If you could mute the microphones, please, all microphones except mine should be on. And we'll have a short introduction from Ernest Ruzindaza, who is the CAADP team leader from AUC DREA, Department for Rural Economy and Agriculture based in Addis. And then we are going to have a short presentation on why the AFSI for short, the African Food Safety Index, is important. Why should it be part of the biennial review? What's the rationale for it? And that's going to be presented by Amare Ayalo. Amare is a PACA coordinator. And then we are going to have the team from PACA present different elements. The way we will proceed is we will pause after each element has been presented and see if there are questions. We use those questions to interact with our presenters. Next slide, please. So the questions and answers will be fielded, but perhaps not all of them. And so we will later on share with you Q&A of all the questions you have. And at the end, we will try to summarize the main issues and the next steps. So that's the plan for now. Someone's listening with a little baby. That's great because that's the future generation. But if you could ask them to be a bit silent for now. Next slide, please. All right, so on your screen now, you'll see the team from PACA that's going to present this. At the bottom right is Ernest Ruzindaza, who's going to come next. But I did not introduce three experts from PACA, who the two ladies. The one on your left is Winter Sidia, which is program officer at PACA AUC. The one in the middle at the bottom there is Wezi Chunga. And on your top right is Dr. Jean Kamanzi, who's a food safety expert with lots of experience. And of course, Dr. Amare Ayalo, who I introduced earlier and is gonna come soon, is the coordinator, program manager for PACA. So without further ado, I'd like to give a few minutes to Ernest Ruzindaza. Ernest, please.
Thank you very much. Thank you, everyone who is participating to this meeting. I don't want to take a lot of time. I want just to say that this training comes as agreed in our Accra meeting. As you remember very well, we've said that we'll conduct some online training to actually take care of some, let's say, unfinished issues, especially for the new indicators or other indicators that might need some more explanation, to member states. So this said, we really want to make sure that member states have required information that can help them to collect data for the upcoming biennial review that will present to heads of state in January 2020. And I think this meeting, this training will be an opportunity to strengthen the knowledge for some of us who participated in Accra, and also to learn more for others who did not even come. And I look forward for a very interactive session. And I think this is just, I will say this is a starting, but we'll continue also for other indicators in case really required by member states. So we'll be making sure that we provide to you the right information so that you can mobilize the required data in quality and quantity as discussed in Accra. I'll pause here and then give back the mic to Robert, who will help us to coordinate this training. Thank you very much.
Thank you very much, Ernest, for those remarks and also broadly for your leadership in this process. As Ernest has mentioned, we expect this to be a very interactive webinar. Ask all the difficult questions you have, and our experts from PACA here will help us to answer them. So without further ado, I'm going to invite Dr. Maria Yalu, who's going to provide in a very few minutes the background. Why are we even interested in having food safety measured as part of the biennial review process? Why is this relevant? Why should we do it?
Thanks very much, Robert. Hello, everyone. I hope you can hear me. Okay, so in my very brief presentation, I will focus on 3 aspects. I will first share with you a quick background, more broadly on food safety, and then I will give you the rationale for the inclusion of the food safety index or food safety as a whole in the Malabo Biennial Review. And then finally, very, very quickly, I will also share with you a high-level overview of the food safety index. Just in few words, I'll share with you the structure of the index. But first, basically, the background for this effort is because food safety is such a complex developmental challenge to Africa that is holding back many African countries, not just their agricultural sector. So, as most of you know, foodborne illnesses actually disproportionately affect the African continent. Africa, although it accounts for 16% of the world population, it actually carries 1/3 of the global death toll, mortality due to foodborne illnesses. So next slide, please. Hello, next slide, yeah. In addition to the public health impact, a recent study by the World Bank actually showed that more than $100 billion is lost annually from productivity loss and medical expense alone. Most of this is in Africa and in Asia. Next slide, please. Next slide. So in addition to the public health impact, actually food safety also affects food security squarely. Actually, unsafe food, contaminated food is not food at all. And in fact, we have also to remember that despite a lot of improvements in maternal and child nutrition in much of the world, including Africa, the rate of childhood stunting is not declining proportionally. In fact, in Africa, stunting has increased in 2017. So actually, Africa is the only region where stunting has increased recently. So probably we have to start to look at issues of food safety and issues of nutrition and not just availability of food. In addition, food safety has become increasingly a precondition for access to market. So because of this complex multi-sectoral effects, we have to understand that food production alone, productivity alone, is not going to guarantee food security and nutrition or even improve trade unless we give attention to issues such as food safety. Next slide, please. If you can't hear me, next slide. Okay, so very quickly as to the rationale of the food safety index, from what I have just said, food safety is crucial to achieve a number of the Malabo Declaration commitments, which are being tracked through the biennial review, particularly the commitment on ending hunger or the commitment on tripling intra-Africa trade, or reducing poverty by 50% by 2025 will be very difficult, if not impossible, to achieve without due attention to food safety. Unfortunately, food safety is not adequately captured in the first biennial review report. It was identified as a gap in the biennial review. And so, next slide. And so we initiated a series of consultations throughout March of 2018 to discuss with stakeholders on how and on if and how we can include food safety in the Malabo Biennial Review. So we started consultation at the CAADP Partnership Platform meeting, and then we had also discussions at the first expert task force of the Biennial Review. Even the Permanent Representative Committee, which is the assembly of ambassadors of EU member states, was consulted. And but I mean, to keep this short, we finally convened a rights shop at the African Union Commission, where we had experts from WHO, FAO, the International Agency for Atomic Energy, CTA, private sector, and so on. And so this participated physically or remotely and helped us develop the concept of the Food Safety Index. Finally, we took the draft to the PACA Partnership Platform meeting in Dakar in October, and we got some feedback. And so this was also presented at the Peer-2-Peer meeting of AU member state experts in Nairobi, and so on. So this has undergone a series of consultations spanning March of 2018. Next, please. So you can actually display all, please. So from these consultations, and especially from the rights shop that was convened at the African Union Commission, a food safety index that is supposed to start small, reasonable, and somewhat simple without being simplified, is the proposal that was initially put on the table. So the food safety index will have three components. One, looking at the food safety systems at country level, and the two others, the food safety health index and the food safety trade index, looking at outcomes of a better functioning food safety system. So I'll stop here, and my colleagues will take you through these three different components. Winta will first take you through the food safety systems index. So maybe before that, you can take me to the next slide where I could share some next steps. Next slide, please. Next slide. So in terms of next steps, we are planning as African Union Commission to organize a regional training specifically focusing on food safety in order to build capacity for data generation in terms of the food safety index, but also broadly in terms of food safety capacity. Then of course the data collection will proceed together with the other biennial review indicators. And we're also planning to validate the food safety index in 2 or 3 countries, maybe 5 countries, one from each of the regions in Africa, using actual data from the 2019 effort. And finally, of course, we'll work with member states and REICs to produce a final report. I should mention at this stage and recognize actually CTA, which is the Center for Technical Cooperation in Agriculture in Africa and Caribbean, is providing financial support for this effort, for the Africa Food Safety Index. So thank you so much. Let me stop here. Over to you, Robert.
Thanks very much, Amari, for that overview. I know a few of our colleagues facing challenges joining us, but if you've just joined us, we are in the middle of a very interesting discussion here on the African Food Safety Index, which has been developed with the support of PACA. And Dr. Amaria Yalo has just given us a background, and we will be able to share with you later on his presentation. We are moving on to discuss specifics of this index, how it has been built. And therefore going to invite colleagues from PACA. I think we'll start with Jan Kamanzi, if I'm not wrong, to present to us this index. And as I asked earlier, if you do have questions, please continue to post them on the chat box, and we will have the opportunity to answer them slightly later on. Jean, is it you who will take us through the next part of the presentation?
No, it's Winter.
Winter, okay. So Winter also works with Dr. Amari at PACA, based in Addis Ababa, and she's going to take us through the next set of slides. I believe specifically talking about the Food Safety Systems Index, which is like a third, based on what Amari has just told us. It's the first part of a three-part index that's been developed by PACA. Winter, please.
Thank you, Robert, and thank you, Dr. Amar, for your overview presentation. As our colleague said, I will take you through the Food Safety Systems Indicator, which is one of the three indices for the overall food safety index. So this indicator actually captures country performance in establishing food safety systems that actually meet international best practices to support food safety in the country. And these are aligned to Codex and are also evidence-based. So for a good food safety system to work, the foundation for this system is actually to have a food safety law or policy or act that is in use, that is established institutions also, agencies that can effectively coordinate the different implementers of food safety control, and also relevant stakeholders and sectors. We also need national standards and guidelines set with an effective enforcement or incentive programs to ensure that food is safe, and robust national monitoring and control programs for priority hazards or priority food commodities are also needed, robust national monitoring and control programs. We also need reliable data and policies that are also supported by functional and reliable laboratory systems. I'll take you through the different parameters of a functional food safety system. The first one, as I said before, if we can go to the next slide. Okay, so as Amara said earlier, the Food Safety Systems Index actually has 4 parameters. And the first one is actually the existence of a legal or policy and institutional framework. The second is actually the quality. We look at the quality of monitoring and surveillance programs. Third, we look at the laboratory infrastructure, analytical capacity, and laboratory performance. And finally, the existence of programs to facilitate and encourage compliance to food safety standards. So these are not very exhaustive, but actually they are the basic fundamental characteristics of a food safety system. Next slide, please. So how we're going to present this food safety index is actually first taking you through what we call the technical guideline, which is a detailed guideline on the different indicators, which also have the parameters, and also take you to the reporting template where you capture and collect data. So first, for this first parameter, is the existence of legal or policy and institutional frameworks on food safety. And what this is actually a food safety policy or law or act that is promulgated in the country in strong partnership with different stakeholders, and existence of risk-based food safety standards in at least 5 priority commodities. So what we need in terms of data is actually the existence of a national food safety policy, a law or an act that has been updated in the last 10 years and that covers the entire food chain. So this is actually to avoid using policies that have been there since 40, 50 years and have not taken into account new hazards or new hazards and new issues. The second is actually existence of risk-based food safety standards for at least 5 priority commodities. And another data that we require is also the existence of competent regulatory institutions with clear mandates and coordination mechanisms. So this is to also avoid competing mandates between different institutions. So how we compute this parameter is actually averaging the 3 different elements of the 3 on the national food policy or law and standards for at least 5 priority commodities, and if there is a competent regulatory institution. So the average of those will actually give us the score. In terms of source, where you can get the data, this is the national competent authorities. It could be the agency, like we said, the regulatory institution, or codex focal points or codex contact points are the sources for this parameter, for the data for this parameter. Next. So this is the reporting template for the same parameter. It's how you'll see here that people collecting the data will answer yes or no for the different elements. For example, existence of national food policy or act or law that has been updated in the last 10 years covering the food chain, people will say yes or no. So this is an example of how the data will be collected. Next. So I will take you to the next parameter, looking at the quality of monitoring and surveillance programs.
If you could just hold on for a second there, Winter, I would love for you to move a little bit faster, given you're facing a time constraint.
Sure, I'll go a little bit faster. Sure. So the second parameter, we're looking at the quality of monitoring and surveillance programs. And this measures food contaminant monitoring, which is a statistically based sampling and processing and analysis of samples to provide information on the occurrence and levels of chemical residues or microhazards in predefined sample populations. So data from monitoring programs will inform surveillance programs. The data we require is the existence of a risk-based and coordinated food safety monitoring and surveillance plan, existence of national epidemiological database or system for foodborne diseases, prevalence, incidence, and mortality, existence of a response system to manage food safety risks from monitoring programs, including standard operating procedures, traceability, and recall systems. And we also require that countries participate in reliable food safety information notification systems, for example, like InfoSan. So computation is also an average. So you can see the computation there. And your sources are, again, national competent authorities, ministries, and codex contact points. Next slide. Again, this is the reporting template for this second parameter. This is a yes or no question, and the average will be computed. Third, I'll take you through the third parameter, which is infrastructure, laboratory infrastructure, analytical capacity, and laboratory performance, which measures the presence of competent laboratories that are capable of producing reliable results to support effective enforcement of compliance to food safety regulations. So in this one, the data that we require are existence of national assessments of in-country laboratory capacities, demonstrable government programs to build or equip and sustain competent laboratories. This includes also human resources. And the minimum elements for this actually is the existence of national training programs for qualification of laboratory analysts, existence of national laboratory standards of qualification accreditation programs for the laboratory, existence of national budget to support the laboratory infrastructure and instruments maintenance, as well as operational and CapEx requirement, which is capital expenditure requirements. Existence of competent laboratories, government official laboratories or private, and their demonstrable fitness for purpose. And how we know that is actually the minimum elements of this competent laboratories are existence of food safety testing, food testing laboratories, existence of laboratory capability in terms of infrastructure and instrumentation, existence of suitably trained people in terms of capacity relative to food safety regulations, and existence of accredited laboratories in food analysis, as well as existence of support on an incentive for industries and producers. Participation in an accredited proficiency testing schemes and inter-laboratory comparison programs. The computation is the same as an average, and your sources for this data will be competent authorities, ministries, and contact points again. The last one, the last parameter is actually existence of programs to facilitate and encourage compliance to food safety standards, which measures government programs for food safety capacity building for various stakeholders along the food continuum, trainings in good agricultural practices, good manufacturing practices, HACCP, etc. The availability and public access of food safety information, as well as the existence of public or industry-driven incentive programs. So the data that we require are existence of national capacity building programs in the various sectors like good agricultural practices, manufacturing, hygiene, and also HACCP. The minimum elements for these are existence of building on GAP, capacity building on GMP, and also hygiene practices. Secondly, existence of capacity building programs in recognized quality management systems such as HACCP or ISO. And third, existence of national food safety awareness raising programs such as radio programs, national campaigns, and workshops. Again, the computation will be the average, and your data sources will be the ministries, the codex contact points, and competent authorities in the country. This is what you see on the screen is actually the reporting template, which is exactly what I also went through, but this is how you collect the data. So I hope I have. Jean will continue with the health and trade indicators. Thank you.
Just to continue our discussion, Winter has presented what we would like to see at a country level as build as systems. So we want really to encourage countries to develop food control systems at a national level. And if you have a good working food control national system, the industry operating and meeting standard, you should see the results, outcome, less foodborne disease, less mortality linked to foodborne disease. And for the trade, you should be able to see a reduction of rejected product which are exported to foreign countries. So the two index, which I'm going to present, which are really outcome of a good functioning national food control system. So the first outcome you should be able to see if your system is working is a food safety index, which is going to be translation by a reduction of foodborne disease, okay, and a reduction of death in children under 5 years of age, and a reduction of rates in cases of liver cancer. Okay, so these are the three, I think, parameters we choose to try to show that, yes, the system is working. You should be seeing a reduction of disease, of death, and a liver cancer. We choose liver cancer here because we know it's a major problem in Africa. Based on a diet of food people are eating, we have data showing that we have a lot of cases of liver cancers which are linked to aflatoxin consumption. Okay, next please. Next. Okay, so the first parameter we want is really the rate of reduction of foodborne diarrhea disease. This is the general population, okay? We want to see a reduction in the general population. And the definition is the reduction expressed in percentage value of the baseline. We use the baseline of 2015, and we want to see the number of cases of diarrhea disease per 100,000 people attributed to foodborne disease reduced. What are going to be data required? So we would like to see the Department of Health coming up with an estimate of foodborne disease, diarrheal disease per 100,000 people per year. Okay, that's really what we want, FPDD, that's what we want to capture. This is going to be done by calculating the number of cases of diarrheal diseases per year, NCCD, divided by, and we want divided by the population of a given year, okay, TP. But we need to come up with what we call, all diarrhea disease are not linked necessarily to foodborne disease. So we need to come up with what we call a corrector for food attribution, which is going here, we estimated, we used WHO data, and we estimated out of 100 cases of diarrhea disease, 40% are foodborne related, okay? So you need to include that kind of corrector. And for one case of a lab, okay, positive for which identify foodborne disease, we know that there are maybe 10 or 20 cases which are not reported to the medical community, because most of the foodborne disease are self-limited, as we call it in a medical jargon. You have a diarrhea, you don't go to see a physician, and you just stay home 2-3 days, and you don't report it to the medical community. So there is non-reporting, which you need to consider. But these data are going to be provided by experts, and we are going to include them in the calculation of how many foodborne diarrhea diseases we have per year. That's really what we want to capture. So now, the computing methods is really the FBDD. It's, as I said, is the total of number of diarrhea disease, which we correct by the underreporting and by the food attribution, and we divide by the total number of diarrhea disease, and we multiply by 1,000.
So, Dr. Kamanzi, sorry to interrupt, but I'm keeping an eye on our clock. We've got just about 20 minutes left on our time, and I'd like to give you another 5 to 7 minutes to cover all the rest of the presentation. So I would suggest that you just brief us on the indicators themselves, and maybe through the presentations, folks can apprise themselves with how they are calculated. Just to save time for some questions at the end as well. Thank you.
Yeah, I think once I have explained the first one, the other are very easy because we use the same approach. Yeah.
All right.
If you can go just back, yeah. Okay. So now the calculations really is to try to come up with the rate of reduction is we use this formula, which we use the number of foodborne disease, okay, per 100,000 people per year. And we report it, we compare it with what we had as a baseline in 2015, and we multiply by 100, okay? And the data source is DHS, WHO, and national statistics. Okay, so this is for the diarrhea in general population. We do, next slide, please. Next slide. Okay, the second, what we do is the, next slide, please. Okay, the second parameter is the number of reduction of death in children and 5 years of age, okay? So this is the second parameter. And we do exactly the same approach, okay? So it's the same calculations, okay? We are trying to estimate the number of foodborne death, okay? Due to foodborne disease per 100,000 children in less than 5 years old. And we do exactly the same calculations, and we come up with the reduction rate. Next slide, please. The third one, okay. The third one is the reduction of case of liver cancer, hepatocellular carcinoma. As we said, there is a direct correlation between hepatocellular carcinoma and exposure to aflatoxin. People are eating food contaminated by aflatoxins. So this is going to be used as a proxy indicator, which will give us an indication on how the system is working and if we are doing well or not, and how many people are exposed to food contaminated with aflatoxin. And we use exactly the same approach, the same calculations, which we can explain later if you want, to try to come up with a reduction. So we want to see these three parameters reduce, a reduction in those three. The last is the food safety trade index. No, come back please, yeah. We want to see a rate of reduction in unit rejection of food commodities due to food safety violation compliance, but disaggregated by type of violation, okay? And what do we mean by a rate of or unit rejection? And next, please. Okay. Here, what we want to do is really to come up, we want to capture the total number of shipment of food commodities exported per year for each country. And the unit of rejection rate, which is the number of rejection per 1 million of export, that's what we call unit of rejection rate, which is, it's really a fraction. Okay, it's the division of the total rejection rate, which you divide by the total of monetary value of food exported, and you multiply by 1 million. That's what we want. That's the unit we'll be using to try to calculate the rate of reduction we want to achieve. The computing methods, and what we want, which is very important, we want to have countries capturing rejection per type of violation, okay? Is it aflatoxin? Is it food contaminant? Is it bacteriosis? What type of bacteria? So we want to, we said you report it by type of violation, okay? It's very important because this will inform the type of controls you need to put in the national control system. Very, very important, okay? Then once this is done, what you want to come up, you come up computing method, you come up with a rate which will allow you to show that you are achieving the reduction which we want in the unit rejection rate, okay? Which is, it's here, if you can see on the screen, it's 1, and you take the unit of rejection rate for a given year, you divide by the baseline, what you had rejection unit rate by the 2015, and you multiply by 100. So that's, and the source is the Ministry of Health, Ministry of Trade, notification systems or information you are getting from the exporting countries. That's the data source we'll be using it. So I hope that I have covered the two index, but if you have any question, we can discuss it. And thank you very much.
Thank you very much, Jean and earlier on Winter, for the presentation of these three areas that together form the Africa Food Safety Index. Now it's time for questions. And what I'd like to do is to start with the last area first. If we have any questions on the trade, I'll call it for now sub-index, because it's really, if you follow the presentation, we're actually making the index out of three elements. One is on the system that you have in the country. The other one is on health issues, which reflects your food safety situation. And the last one is on trade, which is a big part of the whole affair. And so I didn't see specific questions on trade, but I'd like to come back to that. If you have questions on trade, please write them in the chat box. So I'll start with questions we receive on the chat box, and both you, Winter, and Kamanzi may come in and respond to these questions, and Amare, of course. One's from Mamadou's asking whether the corrective factor, and this is on the health part, we are talking about diarrhea and other things, we're using a corrective factor of 0.4. Is this a general corrective factor, or doesn't this vary from country to country, especially as diarrhea, the intensity, the causes, etc., may be different by country? And as you think about that, I will ask a second question that's come from one of the participants as well. And by the way, Baba Kassam, I'm not sure you'll be able to comment, but we will see if we have time at the end. The second question in the area of the health index, Kamanzi, is really about the practicality of the data, yeah? And this is from Okeke. Are we really being realistic? Can we get this data? Noting, of course, the serious underreporting, non-reporting, and the situation with the data systems in African countries. Are we really expecting to get reports? And I think Jennifer Athebe also asked the same question about data. Specific from Florence is, are we talking about reported diarrhea cases or just estimation? I think it's the same thing as well. So I'll leave it there and ask you to respond quickly to those, and then I'll ask another set of questions.
Okay. Okay, let me try maybe to answer the Abaka. The 0.4 or the 40%, which is what we call food attribution. This is based on expert judgment, and it's used also by WHO as, so we estimate that maybe out of 100 cases of diarrhea disease, 40% may be attributed only to foodborne disease. So it's a combination of data and some expert judgment. So it's now, for underreporting, it's a more complicated because this depends most of the time on the type of pathogen we are talking. The underreporting for Salmonella may be completely different from Campylobacter, because you are trying to estimate from one lab sample which came positive, from someone who came to the hospital and sample stools was taken, analyzed by the lab, and you have one positive. But what does it represent? How many people didn't show up at the hospital? So that's what you are trying to estimate. And depending on the severity of the pathogen, okay, you may have a very good case. The underreporting would be lesser than for a case where, for example, the severity of the disease is less. So this is Again, it's going to be, there are going to be expert meeting and try to estimate, depending on the type of pathogen, what is really the underreporting. But this is going to be introduced in the system. You should be really worried because we are going to introduce that factor into the system. It's going to be calculated automatically. So you shouldn't be worried about that. So we'll take care of that. Now, for the data, the practicality of data, I think in Africa, we have countries are at different levels in the national control systems, the medical system, reporting systems. So they are all over the map. We have very sophisticated national medical systems like in South Africa, where we have some very rudimental medical systems in other countries. So it's going to vary. We expect it. How realistic do we expect to have this data captured? It is going to vary, and we expect that. But we hope that we are giving an indication on to countries what is the type of data we would like to get, and they should be really starting working on it. That's basically the most strong message we would like to convey. Here is what we'd like to have as data capture. Thank you.
Thank you very much, Jean, for those responses. I'm sure they help to answer some of the key questions. I've noted a few comments from some of the experts on the call who are saying this is a lot of information to take in one webinar, and they will be able to respond in much more detail once they receive and see the technical notes and the presentations made by Amare and colleagues. And I think we welcome that. So I can assure everyone on the call that we are going to share this information with you and that we welcome all comments. It's not perfect, but we have to start somewhere. And I think that this is something to be proud of because we as Africa are probably the first to develop this sort of thing. I'll ask Amare to comment on that, whether that's true or not. Okay, so I'll go to some more questions. I'll come back to trade. Let me see first if there's any more on health, maybe one more. Have we, in developing this system, and this is a question from Lusubilo Mwamakamba, have we, in developing this system, Jean, if you could answer this very briefly, taken into consideration the international health regulations, M&D frameworks that may exist, so that we are not developing completely new things, but we are probably using existing knowledge? Have we in any way considered, for example, some international codes and regulations or systems?
Mm-hmm. Yeah, thank you. Yeah, I think when you develop a system, we tried to come up what we consider as key pillars to build a national control system. So we know that when you build a national control system, you have roughly, if you look at the FAO manual, we had like 9 pillars. Here we selected just 4, which we think we should be starting with the 4, which we consider as very important. Do you have the legal basis to take an action, which is very important for a country? Okay, so the legal framework. Do you have institutions which are managing food safety issues at a national level? Are they coordinated? So these are the kind of key pillars expert found that's very important. We know that we are lacking data. So very important to have a national monitoring and surveillance system, second pillar. Third, do you have a lab system, which is, this is a tool which is fundamental when you build a national control systems. It's there to try to help you identify what are the issues. Very, very important. And the third, and lastly, the fourth is what are capacity buildings are using to try to strengthen food safety at the national level. These are the four.
All right, thanks. I'll ask one quick question on trade. And so many countries in Africa have invested in ensuring they are compliant with the international requirements for export of commodities, especially agricultural commodities. If you talk about meeting aflatoxin levels for EU trade and other places, that seems to be in place. But does this also apply to compliance for purposes of intra-Africa trade? That is trade between countries in Africa. Would you say that those international standards are applicable in the same way to what happens within Africa? If you could give a 30-second answer, Jean, before I move back to Winter.
Yeah, because if you look, like, what are the standards which are used at international level? They are codex standards, okay, which are negotiated by all member countries in international community, agreed upon. That's what we call codex standard. Many countries in Africa, they have in their regulations codex standards, okay, mandated. So they should be using the same as Europeans are using. But the problem in Africa is they don't have the capacity to do the testing, to control the imports coming in. So we have it's a question of management, which is completely different. They have a weak capacity to manage issues. But from the standard perspective, it should be the same. Did I answer the question? Hello? Hello? I think I lost you.
Sorry, I was on mute. Yes, you did answer the question. Thank you so much, Jan. There were a couple of questions on the systems. I think most people understood the importance of having the systems. Okeke, your comment that under the fourth parameter, I guess, that it's obvious that a consistent and well-driven multi-sectoral approach cutting across various stakeholders along the continuum of relevant actors in the food safety space will be required. That's noted. I also note that there's some comments, for instance, Winter, one asking what kind of evidence would countries need to have? There's also a comment that in some questions, for example, the first parameter where the question is asking on the existence of food safety law, an act or policy, it does not give space to indicate which of those are in existence. So it was generally well understood, except for a few points about providing space and some comments reinforcing that. I don't know if you want to make any comment at this stage, Winter, on any of the points that have come up. And I welcome all of you to also look at the charts which have the questions. Winter, any comments? I think Winter's microphone is off, so I'm going to move to Amare. And if you could unmute Amare's microphone. Amare, when we started, we are coming to the end of the webinar, but when we started, there were some questions for you. And before I even pose those questions, there is one point from, I think this is James Tuitoek, whose understanding is that the computational formulas that you have shared with us and your team has shared with us are merely for our information, and we don't have to necessarily be 100% conversant with them, because all that countries need to do is to input the raw data into the system, and the EBR process and the AU systems will compute the scores. Furthermore, there are questions about how the validation process will happen. You mentioned the validation. When is the validation meeting? Under your next steps, you mentioned that. Regional training, somebody is interested in understanding what that is and when it will happen. And a general question as well on the issue of what happens to technical support for countries that are maybe struggling to develop this index to collect data, etc. Is that something that PACA and the AU in general are willing to provide, that sort of support? So Amari, if you could have some brief remarks as we come towards the end of our webinar.
Yes, thanks very much, Robert, and thank you for your comments and questions. So briefly, yeah, regarding the formula, yes, that's right. Actually, with the e-biennial, The formula will actually automatically calculate the index, and we don't have to 100% capture them, but some understanding of how the computations are done will be good also for anyone involved in this. The validation will take place using 2019 data, so it will be towards the end of the year. And in terms of the countries where the validation will be done, we will choose objectively one country from each of the 5 regions of AU: West, East, North, South, and Central Africa, and we'll try to do the validation in the September to November timeframe. The regional training will be held in Addis, and the tentative dates for that regional food safety training are 13 to 15 May, and most likely these dates will be confirmed, and the training will take place in Addis. Just to comment, Robert, on one small point. Yes, I think somebody commented whether the deadline for data collection has changed. Nothing has changed. We'll still stick to the CAADP, the bigger BR timelines, and we will actually align everything towards that. So nothing has changed in terms of timeline or deadlines. Just to comment one small point, Robert. You know, in terms of aligning this index with the international health monitoring and evaluation, Jen answered it very well. Just to annex briefly, some of the data, for example, diarrheal mortality in children under 5, eradication of this is a global target, and countries are collecting data in that. But we have also to take into account the peculiarities of Africa. For example, African diets are heavy in starchy staples. We heavily depend on diets that are prone to aflatoxin contamination. And that's why the experts recommended including liver cancer as part of the health tracking. So we have tried to look at international health monitoring, but we have also taken into account, you know, the uniqueness of the African food systems.
All right, thank you so much, Dr. Amare. Maybe, and I want to apologize for everyone for going slightly over time. We are going to close in a moment. There was a really important question about the link between food safety and food security, which you started off with, and I'll give you another 15 seconds to reinforce that point. Why are we talking about food safety when we are discussing food security and agricultural development? I think somebody asked that may not have been there at the beginning, but now that we have everyone, if you could just restate the case in 15 seconds.
Okay. Yeah, first of all, the direct link between food safety and food security is because you will be forced to withdraw food that is contaminated from the supply chain. To give you an example, in East Africa, a large quantity of maize was condemned unfit for consumption in 2010. So this directly actually reduces the quantum of food, the quantity of food that is available. So we're talking about here quantity of food. In addition, when the food that is supposed to nourish someone causes illness or causes stunting, in the case of aflatoxin contaminated foods, then of course this is working against the nutrition and food security of the consumers. So there is a direct linkage between food safety and food security. In addition, if you look at the globally accepted food security definition, somebody is food secure if there is enough food of adequate quality and safety, you know, which is also accessible. So food safety is one of the pillars of the globally accepted food security norms, actually.
Thank you very much, Amari, for that response. I know Ernest Ruzindaza was with us on the call, and I would like to bring in Ernest at some point as we come to a close. an important question that is not necessarily just about the African Food Safety Index, but is probably generic, is one on data. And I see from Lizzie Igbine from the Nigeria Women Farmers Association, you wrote and said the need for data and use of data. Are we really collecting data on food safety? But even the question can be quite general. Are we really collecting data as Africans, and accurate data that can inform what we need to do? And when we collect data, what are we going to use the data for? Is the data for technical reasons, storage, or data can be used to measure wastage or reduction of food? I think her question is really around our capacity for data collection and the importance of collecting data. And that's what I'd like to end with, because this may seem daunting. It may seem difficult, but we need to start somewhere. And I believe that I did mention this earlier on, Amari and colleagues, that this seems to be an area where we are trailblazing. Africa normally follows others, but it seems, just from my analysis, I could be wrong, that we are trailblazing. Amari, would you like to comment on that as we come towards the end of this conversation?
Right. So actually, the problem of data is not unique to food safety. It is a little more acute in the area of food safety. But if you look at African agriculture, which is a $2 billion
So someone called Paul Mfinda was speaking. Please mute him. Continue, Amari. Thanks.
Yeah, so data shortage, data problem is not unique to food safety. African agriculture, which is estimated at $2 trillion, is run with very poor quality data. And so I think we have to improve our MN system overall. In the area of food safety, the problem is a bit more. And this is actually why we are embedding for the food safety index in the biennial review. I hope this will trigger improvements in data collection and also use at country level. But I think there is clarity in terms of usage of the data. Data on food safety systems will be important to actually policymakers to improve the system where there is a gap. Is it the laws, the policies, the monitoring, or the testing capacity, or overall compliance? So I think the data will trigger, in my view, evidence-informed policy in the area of food safety in the coming future.
All right, thank you very much. I'm told Ernest may have left the room. I would like to bring this to a close. There's been so many comments, so many questions, we couldn't even get to a small fraction of them. And I think that's testament to the importance and interest that everybody has in this subject. And as I promised earlier on, we are going to try and respond to each and every one of those questions. I see comments from Genar Njai, from talking about how we neglect food safety in rural settings, which are more prone. I see comments from various folks, some of them asking about food safety awareness, raising campaigns that we need to follow. Maimuna, your comment is well noted, Maimuna Lawal, about creating awareness and other things. And I think that this is a start for us to move forward. And I'm sorry, Baba Kasam, that I couldn't also come back to you to give you a chance to share your views, but we would appreciate if you could write in and we will share with everyone. Definitely one of the interesting things that we should do, Amari and colleagues, is to come back once data is collected and we have the first round of the results, to have another webinar and discuss what the results now mean. But for now, I can promise everyone that we have planned the next webinar in a couple of weeks' time, and we are going to announce it to everyone that's on this call as well as others to join us. It will focus on resilience, the measurement of resilience within the biennial review process. And resilience, as you know, is an important aspect. It's a big part of the goals that we have. So the issue of understanding resilience indicators in the biennial review, and we have some experts, including Professor Yalne Bogale and Genevieve Theodorakis from FAO and from the AUC and among others, who will take us through this topic. So please join us again when we share with you the exact date for this next webinar. With regard to next steps on this one, Amara and team have shared with us the steps, so I will not belabor them, including the training that will happen, regional trainings, the validation exercises, and all the technical backstopping for collecting data on this African Food Safety Index. With that, I would like to thank everyone. I see a colleague before we close off, Okeke, asking an important question. I was overlooking that. How can you sign on to the Peer-2-Peer platform? We are going to send instructions to everyone that joined us to show you how you can sign on and be a member and interact there, because we share a lot of information and a lot of news and documents like these presentations and webinars and so on the Peer-2-Peer network, which is a learning and collaboration network for those who are practitioners in CAADP focal points, among others. So we welcome everyone to join and engage. We'll provide a link on the chat box. We'll keep the chat going for a few more minutes. Everyone can write in there before we close off. With that, I would like to thank everyone and invite my panelists from PACA to say their byes, starting with Winter.
Thank you, everyone. I'm sorry I was on mute and I couldn't answer some of the questions, but the comments are also well taken. As Robert said, we will answer the questions separately. Thank you.
Thank you, Winter, and thank you for joining us. Jean Kamanzi.
Yeah, thank you very much for, I was really thrilled to see the interest and how many people participated in this first webinar, which is show really the interest in food safety, which is very encouraging. So I think the issue which were raised are valid, like the issue of data, but we need to try to work on them and try to get them. So that's really, it's an objective which we need to meet. Thank you.
Thank you very much, Jean, and thank you for offering your expertise and time. Amare, we will close with you.
Yeah, thanks very much, everyone who has joined into this webinar, and also for all your comments and questions. We will do our level best to address them, as Robert said. And also, thank you, Robert, and thank you, the host of the webinar. We appreciate it. Thanks, and bye-bye.
All right. Thank you very much. See you at the next webinar.